Hi, my name's Cheryl with CNA course here at Great Basin College, and I wanted to introduce you to the nervous system. The nervous system is the control and message center of the body. It consists of two main parts. You have the central nervous system, which is your brain and spinal cord, and you have the peripheral nervous system, which are your nerves, and the nerves go throughout the body. The brain is made up of four major lobes, and they all control different things. So the occipital lobe is the visual area, image and recognition. The parietal lobe, it controls speech and words, touch, taste, smell, and voluntary muscle control. The frontal lobe controls concentration, planning, problem solving, motor speech area, and the temporal lobe controls the auditory area, interpretation of sensory experience, visuals, auditory memory. So those are the four lobes of the brain. Now the spinal cord carries messages back and forth from the brain to the nerves. And the nerves are electrical signals that feel sensation and move muscles, okay? I did put a few risk factors for the nervous system. One being trauma or injury. Sometimes football players hit their heads, or trauma, car accident. Mental health, anxiety, and depression can also be a risk factor for the nervous system. And also exposure to toxins. That can also be one. Now the normal changes of aging, which I've written here, those are short-term memory loss, sensitivity of nerve endings of the skin, they decrease, responses and reflexes slowing, and the reflex arc, I wanted to kind of show you, this kind of explains that little reflex. So say you touch a cactus and it hurts, so your sensory neuron takes the stimulus into the spinal cord, so you're going to know that hurts. Your motor neuron is going to stimulate that muscle and have you move your hand back. And then the spinal cord carries the stimulus to the brain, which tells you not to do that anymore. So they all work together. And so some of the other normal changes are the response and reflexive slowing, sensitivity of nerve endings, and short-term memory loss. So we went over all of those. Now, 3 common disorders of the nervous system. The first one is dementia. It's an impaired ability to remember, think, make decisions. It interferes, with doing daily activities. Working with dementia patients, residents, it's very important to know how far they've progressed. Talk to the nurse, find out what they can and can't do. It's always important to approach them slowly, speak quietly, look them in the eyes so they can see you. Help them with any activities of daily living that they need help with. Sometimes they'll want to wander off. But if they get aggressive or want to wander, it's always best to stand back and talk to them. Try to reorient them to something else, a different subject or place. And with the cerebrovascular attack, a stroke, now that is a blockage or a rupture of blood in the brain. It can cause weakness to one side or the other, or it can cause complete paralysis of one side or the other. They have trouble with memory, sometimes thinking, awareness, judgment, and attention. So it's important to make sure that we understand what they're going through. We try to help them as much as we possibly can, but try to get them involved in their care as well. That's very important. If you notice depression, anger, isolation, things like that due to the change from one extreme to the other, it can be very painful for the resident. So it's always best to report all that to the nurse. Also, the other one I have here is Parkinson's disease. Now, Parkinson's disease is progressive and incurable. It's certain neurons in the brain gradually break down, and they can break down or die. They cause tremors or shaking, stiffness of muscles, stooped posture, shuffling gait. So when they walk, they're shuffling. Can be very dangerous. You need to watch them, assist them with ambulation if needed. You want to watch for any signs of progression of getting worse, can't walk. With most of the residents with any of these, any common disorders should be watched carefully, and you should know who you're taking care of. So asking the nurse and telling the nurse is the best thing to do. So I've pretty much gone over the nervous system today. I want to thank you for your time and for watching, and I hope you have a wonderful day.